We're going to start with seeing what needs to be done and doing it, because this is chronic for women who are pregnant between 36 weeks and the birth. This is like hustle time. First of all, hormonally, you're beginning to want to nest, which means you're trying to get the baby's room ready. You're trying to get all of the clothes they're going to have, the strollers, how they're going to sleep. What are you going to do if you've been working? What are you going to do about your finances? What are you going to do about the other kids in the home? What are you going to do if this is your first baby and you're trying to integrate a new baby into the home and you don't have a clue what that means? So seeing what needs to be done and doing it is sort of like heightened for women at this phase. And they would really like their partners to come along and be heightened as well. But they're not. And so you have to sort of let that go, because this is a biological mandate in you. It's not a biological mandate in them. But the question is, how do you see what needs to be done in doing it about your pregnancy right now and about the coming birth? And that's what we talk about, the Birthing Better Families. We talk about your need to have prepared your pregnant body to give birth. If you're going to have a non-laboring cesarean, as we've mentioned before in other of these pregnancy academies, your body is still preparing to labor and have a vaginal birth. You're still having a tightening of your uterus called Braxton Hicks. You're still having hormones that are softening your body. You're still having changes to your breasts and changes to your mood and changes to how you feel about pregnancy. So every pregnant woman can enjoy, thoroughly enjoy, taking time from 24 weeks on, you've missed that unless you've taken the previous courses, to prepare your body to give birth to this big object that needs to come out of you, as well as begin to learn the birth and the birth coaching skills that are so essential to you, no matter what type of birth you have. Literally, no matter what type of birth you have, you are doing, which is an active verb, the activity, which is an activity of birthing, giving birth to your baby. We have this weak verb, and I even mentioned that, giving birth. What does that mean? Do you go to a midwife or an obstetrician and expect them to be highly skilled? Of course you do. Well, they should expect you to be highly skilled to do the activity of birthing your baby. Whether you birth home alone or in the car on the way to the hospital, in a birth center, in the hospital, with or without lots of medical interventions or not, or whether you have a non-laboring cesarean, you are doing the activity of birthing your baby, and you will birth better when you have skills. So seeing what needs to be done and doing it is your focus on the skills that you need to accumulate and feel confident that you are going to use while you do this activity of birthing your baby. And throughout this course, we are going to give you some of the Birthing Better ebooks so that you can either learn them now because you haven't done anything to this date and you're beginning to have a concern about it, or to refresh your memory, or to introduce you to the skills again. Keep refining them, do a lot of the practicing to the Braxton Hicks contractions, and commit to doing this activity of birthing your baby using the skills that you've learned.